We're here in Victoria because we are concerned about healthcare in Canada.
There is a clear and concerted agenda to undermine public health care.
The 2014 Accord negotiations going on now are probably the most important negotiations in many decades in this country, because we are either going to use the opportunity to protect, strengthen, and extend public health care in this country, or it could be the beginning of the end of Medicare.
As a Canadian, I'm proud of our healthcare system. I want it to be sustained. I want it to continue on and improve it.
Good evening, everybody. My name is Rachel Tutt, and I'm the co-chair of the BC Health Coalition. We have invited you all here tonight to help raise awareness about the concerns of public health care supporters as the provinces and federal government work to renew the Health Accord and highlight the many positive public solutions available to governments who are truly committed to a sustainable healthcare system. I'd like to start by acknowledging the Esquimalt Nation, whose territory we are on, along with the neighboring Lekwungen and Saanich First Nations. We're very grateful to be here. Now, a little bit about the organizations that are sponsoring tonight's event. The BC Health Coalition is an inclusive and consensus-based network of organizations and individuals that advocates for a universal healthcare system that meets the needs of all British Columbians. The Council of Canadians is Canada's largest citizens organization with members and chapters across the country. They work to protect Canadian independence by promoting progressive policies on fair trade, clean water, energy security, public health care, and other issues of social and economic concern to Canadians. We're here in Victoria because we are concerned about healthcare in Canada. And we see the Council of the Federation meeting that's taking place here in Victoria today and tomorrow as an opportunity for the premiers to work together to renew and strengthen, to invigorate our public health care. But the Council of the Federation meeting also presents an opportunity for us as public health care advocates to have our voices heard. The stated objective of this First Ministers' meeting is the tackling of healthcare sustainability. While this is an important goal, we are here to say the evidence is clear. Public healthcare is sustainable. The increases in healthcare spending come from out-of-pocket costs for private health services that are not covered by Medicare. If the premiers are really serious about addressing healthcare sustainability, they must work together over the next 2 days to address the growing out-of-pocket healthcare spending on for-profit services not covered by our public health insurance. The future of public health care has also been called into question in the wake of the federal government's December announcement that it would cut health transfers to the provinces. They buried it very effectively in the pre-Christmas fury, and we really need to be aware that this has happened. This strikes at the very heart of the principles of equality and universality embodied in a healthcare system that the people in Canada overwhelmingly support. We must demand that the federal government remain a full partner at the healthcare table. Healthcare is a joint responsibility, and the provinces need the leadership and coordination of the federal government in order to implement the national standards and programs that we need. I really look forward to hearing what our guest speakers have to say tonight. We have Maud Barlow, Chair of the Council of Canadians. We have Diana Gibson, Research Director of Alberta's Parkland Institute. And we have Mike Luff, Coordinator and Research and Communications for the National Union of Public and General Employees. We're also pleased to have local reporter and investigative journalist Sean Holman acting as our moderator tonight. And from there, I'll hand it over to Sean. Thanks.
Thank you very much, Rachel. I'm privileged to have been invited tonight to moderate this town hall meeting. It goes, I think, without saying that healthcare is an extraordinarily important issue to Canadians. Indeed, poll after poll after poll, year after year after year, has ranked healthcare as among the central concerns of Canadians. Some have actually said that the principle of universal healthcare has actually come to be one of the elements at the core of the Canadian identity. And yet, the discussion about how to preserve that value has unfortunately atrophied at times to simply be sound bites on nightly newscasts and in newspapers, which is why I'm very pleased to see all of you here tonight to participate in a conversation about this topic. So, as such, later on we'll be having a little bit of a Q&A to accompany this town hall meeting, and I would encourage all of you to participate in that question and answer session. It's your opportunity to also have a voice. And to help kick that conversation off, I'm very pleased to introduce our first of three speakers tonight, Mike Luff. Mike is the Coordinator of Research and Communications for the National Union of Public and General Employees, one of Canada's largest unions at NUPGE. Mike has coordinated campaigns on many public policy issues, including healthcare, education, and social services. He is currently coordinating a NUPGE campaign called All Together Now for Public Services and Tax Fairness. Prior to joining NUPGE, Mike worked on Parliament Hill for several members of Parliament and spent some time working in the Federal Leader's Office. He has an undergraduate degree in political science and a master's degree in public administration. He's a very qualified guy. So let's all put our hands together and welcome Mike.
Well, thank you, Sean, and thank you, everyone, for giving me the opportunity to speak tonight. I just wanted to start by saying that on a cold, snowy night like this in Victoria, guest speakers like me feel a lot like a dairy cow. We both appreciate a warm hand, so thank you very much. So, as I was preparing what to say tonight, I read the Premier's news release announcing their meeting, and they said, and I quote, in essence, "We're getting together to agree on key principles to govern a new health accord and the future of healthcare in Canada." Now, they're not asking for my advice. They haven't asked for my advice, although I keep trying to friend request them on Facebook and get turned down. But if they did, I would like to suggest to them 4 key principles to govern a new accord. The first principle, both Rachel and Sean touched on, and that is values. Public Medicare is, first and foremost, about reflecting core values of equality, empathy, and collective responsibility. The great realization of our parents and grandparents was that these values are the very best ones to guide a society. They knew that successful nations are built on these kind of unifying values, not values of self-interest and greed. And they saw public Medicare as a practical expression and application of those values. They knew that without our health, we don't have a chance, and with it, we always do. So they created a system that said we're all in this together, we're going to take care of each other, and we're going to watch out for each other against all the unending uncertainties in life. So the first principle for a new accord has to be those values, building on those values, not undermining them. The second principle, I think, is economics, smart economics. Public Medicare is the triumph of economics, I suggest, for 3 reasons. It costs less than a private system. Our single-payer system has huge administrative savings compared to the bureaucratic multi-payer system in the US. So it costs us less. But even though it costs less, we get better quality care. Our health outcomes on all major indicators, like life expectancy, infant mortality rate, are way better than the United States and among the best in the world. And thirdly, public Medicare is good for business. It provides businesses in Canada with a competitive advantage and attracts jobs to our country because businesses, employers, don't have to pay for basic health coverage for their workers. Consider the example of General Motors just for a second. Health costs add $1,500 to the price tag of every GM car in the United States. GM spent $5 billion on healthcare in 2009. That's more than it spent on steel. So General Motors is really a healthcare company with an auto division attached to it. So secondly, a new health accord has to be based on this principle of smart economics, which a single-payer system provides. The third principle is innovation. And innovation, if you've read the lamestream media following these discussions taking place, innovation has become a bit of a dirty word. It's become a masquerade, a code word for privatization. But we need to recapture that word because we know that innovation within the public system is happening now, and it's making a big difference. We know the system was built to provide great care for acute illnesses, to be delivered by doctors and hospitals. It wasn't designed to deliver top-notch care for chronic illnesses or the frail elderly or care outside of hospitals. So as a result, there are too many patients in hospitals that should be getting care elsewhere, too many chronic disease patients developing preventable complications, too many people getting illnesses that are preventable. So we do not argue that the system should remain on autopilot, but we do know that the system can be fixed through innovation within it. And there are many excellent examples, from rapid access breast health centers to specialized joint replacement programs to reforming the way drugs are prescribed to multidisciplinary teams working closely together. These innovations have reduced wait times and improved quality. So innovation within the system, not privatization, should be the third principle for a new accord. The fourth principle I wanted to suggest, and then I'll wrap up, Sean, is affordability. The single biggest lie in our political debate today is that public Medicare is not sustainable. The truth is, Medicare is as sustainable as we all want it to be. And I'm going to leave the deeper analysis and numbers to Diana and Maud because they're much smarter than me. But I do want to cover 2 things on this issue. And the first is, it's as sustainable as we want it to be because it's about spending choices and revenue choices. Let's look at the spending choices. It's not credible for Mr. Harper to say the federal government can't afford to invest more in Medicare. There's lots of money in Ottawa. The problem is Mr. Harper spending it on the wrong things. One in 5 Canadians today suffer from a mental health problem. Mr. Harper should choose to negotiate a new health accord that invests in supports and services that take care of those people, not choose to spend $10 billion on US-style mega jails. When you're in an economic recession and people are losing their jobs and they're anxious about their financial situation, Mr. Harper should choose to make their lives more affordable by negotiating a new health accord that includes a pharmacare program that makes their lives more affordable. He shouldn't choose to spend $30 billion on fighter jets we don't need. When many people are working 2 jobs, juggling family responsibilities and trying to look after aging parents, Mr. Harper should choose to negotiate a new health accord that invests in home care and long-term care services that take care of the elderly. He shouldn't choose to spend billions on corporate tax cuts and G20 political slush funds. So, when we hear Mr. Harper say public health care is not sustainable, just remember those are code words for what he really means. He really means he doesn't believe in public health care or its values, and he's got other priorities, like jets, jails, and corporate tax cuts. There's lots of money in Ottawa to build the best healthcare system in the world. The problem isn't healthcare costs, and Diana will talk about that. The problem is that the money is in the wrong hands and Mr. Harper's spending it on the wrong things. Finally, on the fiscal side, on the revenue side, the fiscal challenge for the federal government and most of the provinces is that it's a revenue problem, not a spending problem. Mr. Harper claims the deficit is a huge problem and that government spending is out of control. But if you actually cared to look at the numbers instead of just making things up, he would tell you, he would know and he would say, there is no deficit crisis at the federal level in Canada. We're in the best shape of the entire G8 by far. It's not even close. The federal deficit today is just over 30% of our gross domestic product. In most of the other G8 countries, it's approaching 100%. When we hit the so-called debt wall under the Mulroney government, the deficit was at 70%. We are in good fiscal shape. The deficit will come down over time as the economy recovers. At the same time, when you look at total government spending, not just healthcare, but total spending, governments in Canada today spend way less than we did in 1992. It has been decreasing year after year. So as our economic pie got bigger, the slice going to public spending has been getting smaller. It was 53% in 1992. It was 39% in 2008. So there's not a deficit problem or a spending problem, but there is a revenue problem. Since the mid-90s, governments in Canada, municipal, provincial, and federal, have spent billions on tax cuts. They've spent $90 billion on tax cuts every year. That's not a cumulative figure. That's how much revenue they have given up every year. Mr. Harper says the deficit's the problem, but on January 1st of this year, he passed another corporate tax cut. Dalton McGuinty says that the deficit's a problem in Ontario, but he's passing another corporate tax cut on July 1st, getting mad, on July 1st. You know, my grandfather gave me a piece of advice when I was young. He said, Mike, when you're in a hole, the first rule is you stop digging. Apparently, Mr. Harper and Mr. McGuinty and others have never heard that. So the truth is, as I wrap up, if governments weren't spending so much on tax cuts, we wouldn't have deficits today. And on top of that, we could afford to expand Medicare to include new programs for home care, long-term care, pharmacare, and mental health services. This is a critical part of the battle for us. Medicare's opponents know they can't win the battle of values, or the battle of economics, or the battle of innovation. They know the only way to get rid of Medicare is to not give governments any money in the first place. That's why we've heard so much propaganda about tax cuts for the last 15 years. So the fourth principle for a new health accord is the recognition that Medicare is as sustainable as we want it to be. It's all about choices on the spending side and choices on the revenue side. So those are my four principles: values, economics, innovation, affordability, and I thank you for the chance to be here tonight.
Thanks, Mike. And now I'd like to introduce the next speaker, Diana Gibson. Diana is the research director of the Parkland Institute, a social policy research center based at the University of Alberta. She has conducted research and worked nationally and internationally on topics ranging from free trade to energy policy to healthcare to education. She is the lead author of the book, The Bottom Line, The Truth Behind Private Health Insurance, as well as numerous other reports on healthcare policy. Diana?
Hi, everybody. Thank you so much for coming out. I'm not going to do half of the things that Mike promised you I'd do, as Diana will say. I want to start with, and I'm not going to refer to any dairy cow metaphors. I want to refer back first to the digging of a hole reference that Mike made and say that, as he mentioned at the end of his talk, that this is an intentional strategy to undermine government and undermine public programs. And I once, when I was doing a speech, channeled Grover Norquist. Anybody here know who he is? I just like the name Grover. He was a key advisor to the Bush administration, and he had this great epiphany early on. He's a very sort of big right-wing backroom guy. The idea that the more they shrink government, the more room there is for private sector profits and corporations. And given that there aren't that many new frontiers for corporations to go out and take over, the public sector is one of the biggest frontiers left. We've got a great lucrative market ready for private investment. So he had this great idea. Let's shrink the size of government. And his famous quote is that he wanted to get government